What if your blood sugar is higher than normal every morning, even before you've eaten breakfast? For many people, fasting blood sugar can be one of the first clues that their body is having difficulty managing glucose. But here's the good news. Your morning blood sugar isn't determined by one meal or one day. Your eating pattern, physical activity, sleep, stress, body weight, and, when necessary, medical treatment can all play a role. And you don't need a miracle drink or extreme diet to start making healthier changes. In today's video, we'll look at practical, evidence-based habits that may help improve fasting blood sugar over time. Let's begin. Fasting blood sugar is usually measured after you've gone without food for several hours, commonly overnight. For many adults, a fasting glucose level below 100 milligrams per deciliter is considered normal. A fasting level from 100 to 125 milligrams per deciliter falls in the pre-diabetes range. A fasting level of 126 milligrams per deciliter or higher can be consistent with diabetes, but diagnosis usually requires appropriate medical confirmation rather than relying on a single home reading. That's why your numbers should be interpreted in context. If your fasting glucose is repeatedly elevated, don't panic. But don't ignore it either. Talk with a healthcare professional.
One of the most important steps is improving what you eat regularly. You don't necessarily have to eliminate carbohydrates. Instead, focus on the quality and portion of your carbohydrate foods. Choose more vegetables, beans, lentils, whole grains, nuts, seeds, and whole fruits. Try to limit frequent intake of sugary drinks, sweets, and highly processed foods. A balanced meal containing protein, fiber-rich carbohydrates, and healthy fats can be more satisfying and may help support steadier blood glucose performance. There isn't one perfect diet for everyone. The best approach is one you can maintain. Fiber is especially useful when you're trying to manage blood sugar. Fiber-rich foods include vegetables, beans, lentils, oats, whole grains, nuts, seeds, and whole fruits. Because some types of fiber slow digestion and carbohydrate absorption, they can help reduce sharp rises in blood glucose after meals. Start gradually if your current diet is low in fiber, and drink enough water. A simple change could be replacing refined grains with whole grain options more often. Here's one of the simplest strategies. Move more. Physical activity helps your muscles use glucose for energy forever. Regular activity can improve blood glucose control and support a healthy weight. The American Diabetes Association recommends that most adults with diabetes aim for at least 150 minutes of moderate to vigorous aerobic activity each week, spread across at least 3 days, with no more than 2 consecutive inactive days. But you don't have to start there immediately. If you're currently inactive, begin with something manageable. Take a walk, use the stairs, do light strength exercises, or simply take movement breaks during a long sitting period. Consistency matters.
Walking is excellent, but strength training deserves attention too. Muscles are major users of glucose. Activities such as bodyweight squats, resistance band exercises, wall push-ups, or weight training can help build and maintain muscle. For adults with diabetes, the ADA recommends resistance exercise 2 to 3 times per week on non-consecutive days. You don't need a bodybuilding routine. Start at a level that's appropriate for you. If you have medical conditions or are new to exercise, ask a healthcare professional about the safest approach. Your morning blood sugar can also be influenced by what happens the evening before. A very large late-night meal, lots of sugary foods, alcohol, or a generally unbalanced eating pattern may make blood glucose management more difficult. Instead, aim for balanced evening meals and avoid making late-night snacking a daily habit. But remember, there's no universal rule that everyone must stop eating at a particular hour. Your total eating pattern matters more than a single clock time. Sleep is often overlooked when people talk about blood sugar, but it's an important part of metabolic health.
Poor sleep can make healthy eating and exercise more difficult. Research and diabetes guidance support getting adequate, consistent sleep as part of diabetes management and metabolic health. NIDDK notes that most adults should aim for roughly 7 to 8 hours of sleep each night. Try going to bed at a consistent time. Reduce bright screens before bed. Keep your bedroom comfortable and dark. And create a relaxing nighttime routine. Better sleep can support better overall health habits.
Stress can affect your daily behavior, your appetite, your sleep, and your body's glucose regulation. You don't need to eliminate stress completely. Instead, develop healthy ways to manage it. Try walking, deep breathing, meditation, time outdoors, talking with someone you trust, or simply taking short breaks during a stressful day. Managing stress is part of a healthy blood sugar routine. For people with overweight or obesity who are at high risk for type 2 diabetes, even modest weight loss can have meaningful health benefits. The 2026 ADA standards recommend a target of at least 5 to 7% weight reduction for adults with overweight or obesity at high risk of type 2 diabetes, alongside a healthy reduced calorie eating pattern and at least 150 minutes of moderate physical activity per week. But don't chase rapid weight loss. Focus on sustainable habits, healthy meals, regular movement, adequate sleep, and gradual progress. The word fasting can sound like a simple solution, but fasting is not appropriate for everyone. If you take insulin or certain diabetes medications, changing your meal schedule or fasting can increase the risk of dangerously low blood sugar. Physical activity can also lower glucose for hours afterward in people taking certain medications. So don't suddenly start prolonged fasting because you saw it online. Talk with your healthcare professional first, and never stop or change prescribed diabetes medication on your own. You may have seen claims about lemon water, apple cider vinegar, cinnamon, or special blood sugar detox drinks. Some may be fine as part of a healthy diet, but none should be presented as a guaranteed way to normalize fasting blood sugar. Water is a simple choice, and if your blood sugar is consistently elevated, the answer is not another trendy drink. It's understanding the cause and building an appropriate treatment plan. So, how can you help reduce fasting blood sugar? Start by improving your overall eating pattern. Eat more fiber-rich whole foods. Reduce sugary drinks and highly processed foods. Move your body consistently. Add resistance training when appropriate. Get enough sleep. Manage stress. Work toward a healthy weight if needed. And follow your healthcare professional's treatment plan. Remember, there is no single food, no miracle drink, and no overnight solution. Better blood sugar control comes from habits that you can repeat consistently. And if your fasting blood sugar is repeatedly high, don't try to diagnose yourself from internet videos. Get appropriate medical testing and professional guidance. Because the goal isn't simply to get one good number tomorrow morning. It's to build healthier blood glucose control for the long term. If you enjoyed this video, don't forget to like, subscribe, and turn on notifications for more evidence-based health facts and wellness tips. Thank you for watching, and we'll see you in the next video.